This is Dr. William Anderson from the Neurosurgery Department at Johns Hopkins and the Functional Neurosurgery Laboratory at Johns Hopkins Hospital, just giving a brief lab tour of what our projects are and opportunities for interested engineering students. Our lab performs very innovative brain recordings in patients that have epilepsy or Parkinson's disease. And with these recordings, we try to understand neural circuit behavior as well as the development of a variety of neuromodulation systems. Additionally, we use this data to create and optimize computer models of the brain and on a variety of computational platforms, and we welcome student involvement in all of these opportunities. In terms of our recordings, a lot of our efforts revolve around the creation of a neuromodulation system appropriate for Parkinson's disease. We perform many of our deep brain stimulation lead placement cases in the operating room with patients awake that are interactive and able to undergo testing studies. We also use robotic guidance. You can see our ROSA robotic system with our Medtronic O-arm. We also perform both surface cortical LFP recordings along with microelectrode recordings in the subcortical structures at the same time. We're interested in developing modulation systems that address biomarkers that are present in Parkinson's disease. Specifically, we're interested in the phase amplitude coupling reduction seen with deep brain stimulation and how we can tune our stimulation therapies to selectively address this biomarker. One approach we are looking at is phase-dependent stimulation, where the stimulation pulses are timed at specific phases in recorded cortical rhythmic activity. Our intraoperative studies provide a unique environment for performing these recordings, including our ability to pass subdural strips through the burr hole used for deep brain stimulation cases, and then apply stimulation pulses to primary motor cortex during testing episodes. We use an autoregressive modeling algorithm running on a processor to forward predict when the stimulation pulses should happen. And we focus on phase amplitude coupling metrics to verify that we can selectively modulate this biomarker, including with trough timed stimulation pulses relative to beta rhythmic activity. We can reduce the PAC modulation index, and with peak time pulses, we can selectively increase. This diagram shows us where our recording electrodes are placed over the primary motor cortex and our ability to selectively modulate this biomarker. We also perform motion tracking in the operating room, looking at the cardinal movements for the Parkinson's examination. We use lead motion detection for these motion capturing portions of the testing. Here's a quick movie of that showing the lead sensor detecting hand movement in the left panel. In the center panel, the microelectrode recording setup, and in the far right panel, we're also able to perform center outreaching tasks for these patients as well. Our goal is to create an implantable neuromodulation system that is biomarker based. In order to do this, we've had to develop sophisticated stimulation artifact reduction techniques. We can perform a variety of neuromodulation, including cortical beta phase dependent cortical stimulation, cortical beta phase dependent subcortical stimulation, and traditional deep brain stimulation that is still guided by biomarker levels. Processing requirements of these studies, we've had to invest in FPGA technology to rapidly analyze our incoming ECOG data stream and to time the stimulation pulses. Currently, we're using one of the Xilinx Zinc chips in these efforts, and this is a joint application project with the Applied Physics Lab, and we welcome students who are interested in programming these devices as well. On the flip side, our cortical modeling work involves trying to understand stimulation-induced effects on the cellular neural populations underneath the stimulation electrodes. These are studies that are focused on the 2.2 millimeter diameter electrodes we use in our epilepsy population. And the simulations are conducted in a finite element modeling environment with COMSOL, with active neural tissue simulated by Genesis, one of the large freeware neuromodulation systems. This demonstrates a recent case in which we implanted 6 total Utah arrays in a patient, and we're also reproducing the gyral structure in the COMSOL environment to try to understand cortical microstimulation. The bottom panel here shows some of the cellular populations that are influenced by microstimulation pulses. We also use a variety of image analysis-based techniques to understand the local field potential recordings that we derive during these recording sessions in both micro and macro stimulation studies. And additionally, we have an interest in drug diffusion as well, and we found that this COMSOL environment is very useful for us in understanding the diffusion of drugs in active neural networks as well. We have active projects with the Applied Physics Lab Microwave Group in developing both focused neuroablation system as well as microwave-based imaging projects. Thank you very much. I hope you're interested in our laboratory. Please feel free to reach out and contact us. Thank you for your attention. This is some of our contact information. Please feel free to email me, as well as Yusuf Salampur, who performed most of our human subjects recordings, and additionally Pablo Kudela, who is helping with most of our computational modeling projects. Thank you very much.